So we covered a lot in the first lecture in terms of what is mental health in the Muslim community, the different taboos, the stereotypes. We had some interesting discussions in terms of, what are the reasons that people don't get support, don't get help. We also took a look at a lot of issues that we are experiencing and how to cope and deal with it, and intergenerational, cultural, and all of these. An interesting question that came up is, how can you tell if somebody is just dealing with a cultural issue as opposed to an actual mental health issue? I would replace the word cultural with anything that you could think of when it comes to, is it an actual mental illness or is it ABC? Because sometimes there's a lot of factors that can affect us that way, right? So the short answer to this long answer potentially is that if you were dealing with something or know somebody who's dealing, let's say, we'll use the word the example of depression, okay? How do you know if they're just sad or really dealing with depression? So clinically, there's a few things the doctor would be looking for. The overall idea is that what's their hygiene like? What's their motivation level like? Are they overeating, undereating, oversleeping, undersleeping? What's their engagement like with the community, with their family, with their, so if this has been going on for a long period of time, usually for a few weeks, then we're potentially dealing with somebody who could be dealing with depression. So it's not just necessarily they don't feel like doing this or they've lost, they're not as passionate about something. We all have that fluctuation sometimes. Something that's interesting for us is no longer interesting later, but then does that mean that I'm depressed? These questions could come up sometimes, right? The function, yeah. They're not at their full intellectual capacity thinking, they're out of focus, it's things like that. But these are things that I would recommend when you go see a doctor and talk about. What we're going to be talking about next, inshallah, is developing Islamic counseling theories and clinical practice at a university community setting. And this, I think, will be very interesting for those of us who are practicing Muslims and really engaged in spirituality and concepts of psychology. And I kind of talked about that a little bit last night. This was actually based on my research, my graduate studies research I did years ago, I'm not going to tell you how long, but years ago, where there wasn't anything out there at the time in terms of journals, conferences, experts in the field. I was pulling here and there from loosely written articles on the internet to really bad translated books. And I did a lot of qualitative type of research in terms of talking to people, sheikhs, learned people in the community, to put this together. Now, mashallah, there are journals, there are conferences, there are a lot more happening if you look around in our communities. Sometimes it's hard to see because, like I saw the shocked expressions of some of the stuff that I brought up here today, it's still fairly new. So given Islam's growing importance and relevance in North America, as well as the increase of the Muslim student population in our institutions and all of that through immigration and all of that kind of stuff, it's really important that researchers and therapists understand the complexity and diversity of our religion to help Muslim clients and what are the needs of that, and also within our communities. So, like I said, this research I put together in terms of what I feel would be a good overview for therapists, non-Muslim therapists to use for Muslim clients, but also for us to understand the connection of Islam and counseling. Okay, and I presented this at Caucus, which is the colleges and universities service national conference in Ontario. They had it in Ottawa, so I was able to represent my university, alhamdulillah. It was the only Muslim presentation there. It was pretty cool because they had over 1,000 participants who came, and it was one of the workshops there. And so it was really great to see the non-Muslim practitioners learn about this stuff to take it back to help. And it's encouraging for us to know that this is important for them to be able to treat people in the community. So just going to skip over that. In terms of, why learn about Islam for therapy? We're going to take a look about that idea in terms of, why should we do that? And like I said, it's because we have such an influx now of more people. But within our own community, like we were discussing earlier, we need to learn more about this. So I want you to pretend you're learning about almost Islam for the first time, let's say, but also recognizing the concepts that we're going to be discussing here, because you've come across this before in your readings and lectures and discussions, okay? So in terms of Islamic counseling theories and Western counseling practices, like I was saying, we have Islamic scholars, therapists, and practitioners who have not addressed this area of study in a satisfactory way, other than stating that Islamic counseling need to be developed in a well-structured discourse that would take account of our faith's approach to healing as a manifestation of divine mercy, where the therapist and the client are part of this holistic process. And so these assertions are usually directed at the presence of our mainstream Western counseling practices, right? And so there's lots of information from different perspectives out there, but it hasn't been put in a structured or defined, organized, theoretical model for Islamic counseling. This lack of methodology is noticed where and when? Well, it's noted in the social services institutions, the counseling professionals, because they find themselves at a loss in terms of how to intervene effectively with Muslim clients, right? Especially when it's at variance with their own knowledge. So the client, what does this happen? For the client, it means that they feel that they have a counselor who doesn't understand them, basically, because of this variance. And so, given that the Islamic counseling is not yet in a form where its actual implementation can be monitored, it first requires guidelines that can be integrated into a framework. And the purpose of this presentation is to present various ideas from different Muslim counselors, psychologists, psychotherapists, and religious and spiritual leaders, schools of thoughts, and other sources, and in my attempt to create some kind of theoretical framework.
Has this approach to adapted faiths been already applied, for example, to Jews, Christians, or
yes,
so we can inspire such similar guidelines?
This specific one? Or, sorry, theirs.
Theirs.
Theirs, they have. I mean, in Ottawa, we have the Jewish counseling services. We have the Catholic immigration services, which has, their faith-based, and not just, it's open to everybody, really, not just that. But they do have. And also, in the last few years, we do have Muslim family services in Ottawa. And it's basically from a Sunni group, but it's open to everybody, and it's slowly getting there. We're getting there, slowly, inshallah. But we need to up it up in our own communities, And by doing that, how do we do that? Is by understanding like what we've been talking about today. So this is what we're going to take a look at. And you're going to have to forgive me. I am going to go a little bit faster. So try to keep up because it's a lot of information. But do ask your questions as we go along. But I personally find this so interesting and fascinating just because I was finally, after doing this in my research years ago, I got into the counseling world and I would apply this stuff with my clients, but again, not through that theoretical framework of, okay, this is what we have, let's do this. But I've been giving these presentations for years early on at the Royal Mental Hospital and universities and different counseling groups who wanted to learn more, but it just wasn't, back then we didn't have social media like we do now, right? And so it really took off with social media with this stuff and a lot of interest in our communities when they started seeing some of the presentations that I was doing here and there, like, hey, we do need to talk about this more. So I'm really excited about this because like I've been doing specific presentations on research that kind of just sat there. I didn't really publish it or do anything with it back then. But now it's becoming more interesting for our communities and they see the need. And inshallah, after this presentation, you'll understand why it's so exciting. So we're going to take a look at what you see here. We're going to take a look at the various major constructs. Because as we were saying, the Islamic theories and practice, they're defined, as we know, in terms of Islamic spiritual and mental health principles in the treatment of counseling of clients. And so we're going to take a look at the Islamic concepts derived, or the counseling concepts derived from Islam's various spiritual traditions in the terms of Islam as a way of life. We're going to take a look at the inner relationship between man and God through the connection of the nafs, the self, and its three different aspects. Other important concepts we're going to take a look at is free will and choice, balance and development, fitra, the nature of motivation. Then we're going to take a look at balance and development. Sorry, I already said that, how behavior change, learning occurs, various goals of treatment, different treatment techniques, skills, and various methodology. And finally, we'll do an activity to compare other Western theorists to Islamic counseling. So keep the concepts in mind. Those of you who studied counseling or whatnot, you'll see, you'll recognize some things as we go along. All right, so let's get to it. So we're going to take a look at all of these. So let's start with spirituality as a way of life. So in Islam, we know that man is considered an integral composite of the physiological, the psychological, mental and spiritual components. And so it is precisely this integrated model that presents Islam in a comprehensive way of life, including in its theories of counseling. So from Islamic perspective, religion is spirituality, right? And sometimes there's no distinction between the two. And this also can be applied to science in Islam, where the two are not at opposite sides, but rather they complement each other. Now religion, could be the duties, the responsibilities and whatnot, and you can pray and do all that. But then sometimes there's no spirituality involved with that. And Islam teaches, no, it's integrated with each other, right? It's all about that balance again. So in essence, the Muslim practitioners propose that Muslims use positive aspects of Western psychology that complements our basic principles to integrate it with the spiritual and develop Islamic psycho-spiritual counseling methodologies that could facilitate positive change in clients. So, for example, when we take a look at psychoanalysis, it looks at the unconscious. The cognitive psychology looks at thoughts. And then if we look at behavioral psychology, it looks at just behavior, right? So these newer, more integrated therapies that we have now, they bring more of the spiritual, whereas the others, they're devoid of the spiritual, right? So it's not as comprehensive. So we take a look at existential humanistic psychology. I love that in my undergraduate studies, and I really explored that more in my graduate studies, because it includes spirituality and talks about the self in terms of its connection to Allah, right? So how does Islamic theories compare to that? Well, in order to understand the self, it requires first to study the spiritual aspect of the self, right? And so this is where we get into questions, fundamental questions, like where have we come from, what is our purpose, and what happens after we die, and all of this is in relation to Allah subhanahu wa ta'ala. So the definition of Islam in relation to the self, we know that the Arabic word for the word Islam is to submit. It comes from the word peace, right? And so when we say the actual meaning of Islam, it's about that surrendering. We know this as Muslims, so it's interesting to present that to a non-Muslim audience to understand that basic concept before we got into further in terms of that. So when we talk about peace and inner peace, right, the implication is that the client, the person who's struggling, is finding an inner peace that will bring them ultimately closer to Allah. And that's the basis of when we talk about Islamic counseling. It is this concept, constantly bringing yourself closer to Allah. The concept of the nafs, and I brought that up very briefly in last night's lecture. And we know the Arabic word for nafs is used in the Quran. It is interpreted as self or soul. And so we know it has its good or evil tendencies, right? And it can be pulled towards the higher or the lower self and potentials of ourselves. So due to the different possible states of the self, there's many different types that's been described in the Holy Quran. And there's an agreement among scholars that the Quran has described the three main parts, ranking from the worst to the better one in one entity that could be looked at in this triangular entity. So the nafs al-ammara, the commanding lower self, the nafs al-lawwama, the self-reproaching self, and nafs al-mutma'inna. So I'll bring it back because I saw you guys want to take a picture of that. Go ahead. So the three main types. Let's start with nafs al-ammara, which is the commanding or lower self, and we see that in the Quran in chapter 12, verse 53. And so what does this self talk about? So it's prone to the lower aspects of ourself, representing the negative drives in man. And so it can be viewed analogous to the Freudian concept of the id. So I want to do it now. I don't care if it's right or wrong. I just want to do it. This is also could be part of the inner child. There's no right or wrong, just wants to go and do it. So this is what the nafs al-ammara is about. Nafs al-lawama looks at the self-reproaching part. I'm going to need to change this because I keep skipping by accident here. So this corresponds to the self that is aware, and it's the gateway of the right and wrong, where it feels remorse. And this is the first major step when we talk about the psycho-spiritual growth in our development. And so again, it's parallel to Freudian superego, where it's the feeling of, I shouldn't have done that, or why did I do that? Again, there's that reproach, I wish I hadn't. And the next and the last is the nafs al-mutma'inna, the peaceful self. So this is the state of inner peace and happiness when you're satisfied with yourself. And so this is interesting to look at, though, through sincere repentance, for example, and prayers and supplications and good acts that make us feel good. This allows us to control the lower self, commanding self, and this is through discipline, right? And avoidance of acts that could cause us anxiety, remorse, or guilt. So we want to note here that the nafs is one entity with these three parts. So the psychological and the spiritual conflicts that arise within us is when the nafs al-ammara is the dominating part of ourself. This then will prevent you from reaching the goal of the nafs al-mutma'inna. Conflicts also arise when the lawama is static in its awareness and acknowledgement of its guilty acts, right? And so this will not allow you to move forward in attempt to reach that nafs al-mutma'inna. And the whole point is that nafs is in constant influx, constant change. So the same person can experience different states within themselves at different times, depending on the circumstances, right? We take this a little bit further. We've heard this term before, jihad al-nafs. Now we know this word has been taken out of context in mainstream media, right? But for us, what does the word jihad mean? It just means struggle with the self. That's what that word really means, right? Especially when you have the nafs al-ammara, that it's constantly, in battle, you could say, with the lawama to get to the mutma'inna, right? So this is the main difference I would find when we're talking about Western psychology and counseling than with Islamic counseling, because again, we're constantly talking about the nafs al-mutma'inna in its attempt to strengthen its relationship with Allah to overcome the nafs al-ammara. We don't really see that in Western psychology. So in essence here, it's a journey, right? It's a journey of the self to Allah, and it takes place in order to attain that inner peace. So within this journey, there are choices that we're constantly faced with to get to where we want to go. This now brings us to free will and choice, and this is a little bit hard to work through in our mind sometimes, but it's fascinating when we listen to lectures and we talk about this. I know Dr. Shamali, he works with these concepts a lot when it's spirituality, right? So Islam states that man is free to choose his or her path, right? So events are not predestined. We don't believe that, but it's essentially that willpower rises within us and it makes it possible for us to perform or not to perform a certain deed, thus giving us that freedom of choice, right? So we're capable of choosing these various paths. We have that. Some are consistent with the Islamic aim in life, to being closer to Allah, and others may not be, right? So man is able to create effects in the world by means of his will, where the capacity, the ability to perform is from Allah subhanahu wa ta'ala, but the choice to use that capacity is from us. So there's a differentiation there. So when linking all of these concepts, the implications are significant. So for example, a person who's depressed, right, doesn't choose to be depressed. This was brought up, I think, earlier by somebody. Do you remember? We don't choose to be depressed. But the depression occurs when the nafs al-ammara is dominating the nafs al-mutma'inna, therefore preventing us from reaching that inner peace, right? So once that person becomes aware, they become aware of the state of depression they are in, whether it's through therapeutic means or introspection, or they're noticing they're not at their full potential, then that person has the potential or has the choice to do something about it. So they can either let the depression overtake them, or they can overtake the depression. So it's essentially their decision to make the choice of the action that would facilitate them to reach that inner mutma'inna self. So the fact that he has the choice gives the client, when they come to see the therapist, the empowerment they need to improve the quality of life. So even though researchers state that the choice a man has to take the actions he desires is a positive element in Islamic counseling, there's still a weakness, and I also agree with this weakness, that a therapist or client who does not have the basic understanding and knowledge of Islamic principles, they would perhaps not be able to necessarily apply this in the therapeutic process, right? Because the Islamic principles are believed to appeal to the spiritual aspect of man, not just necessarily to Muslims, people of other faiths, right? So it shouldn't matter if somebody's Muslim or not. So, but we know as therapists that the effectiveness of any therapy would have to involve some kind of believing in the system of ideas, right? It's more effective. So therefore, to have a full positive effect or outcome of any therapy, both the therapist and the client should believe in at least the therapy's basic principles. Does that make sense? You may not necessarily apply them in your life, but at least have an understanding and agreement to that. So, balance and development. So balancing the physical and the spiritual parts of the self is very important, as we know in Islam. So one should not go to the extreme of emphasizing one aspect over the other at the expense of the other. So balance has its implications in our faith as an important area of self-development. Western psychology conceptualizes self-indulgence as removal of moral restrictions on people so that they are not repressed, right? We kind of see that when it comes to, let's say, women who wear the hijab. Oh, you're so repressed and you're repressing yourself. Whereas for us, the physical hijab is part of the spiritual manifestation of our beliefs, right? So that's not how Western psychology sees that. So the Islamic model that I am working with here is seeks to establish an equilibrium within the physical aspects of, so that they're neither denied or overindulged. And so the notion of moderation is related to the concept of the ideal states of balance and adopting the middle way, which is very important within our faith. So by taking the middle path, okay, by taking that middle path or adoption of the middle path, in the Islamic perspective, is thus a means and an aim for self-development and fulfillment, right? So this way, boundaries determined by Allah subhanahu wa ta'ala are not viewed simply by limiting the human self, but it provides parameters within which ultimate inner balance and development can take place. It's interesting, huh? So let's keep going with these ideas in terms of the concept of fitra. So we know that in terms of the Islamic view of basic nature of man's motivation, it's related to the fitra, which is the human nature of motivation and man's disposition, right? So it refers to the primordial state of man, the natural condition, and our faith posits that the natural state of man is a positive one, a good state, because it's of submission to Allah subhanahu wa ta'ala. So the defining experience of man in the Islamic perspective is not his physical aspect, but the spiritual, right? And so this aspect is what the Quran, along with the spiritual traditions, appeals to within us. So man is considered an integral composite of physiological, psychological, mental, and spiritual components, unaffected materialism or sectarianism. And so if early, this is a really interesting one, if early childhood experiences are considered to impact us strongly on our lives, so even unconsciously, as suggested by Freud, who's a famous psychoanalyst, the impact of such an experience going back to an even earlier time would be fundamental, all right? So according to an Islamic point of view, this explains the instinct in all individuals for right and wrong, although sometimes in others it can be more buried deeply, right? So spiritual experience is then therefore a form of recognition, because we believe it happened way before that a childhood experience, for example, right? So it's a recognition rather than a discovery, and that the idea of the Islamic journey of the self. So So this is the flow, and we've heard this before. We've come across this in lectures and discussions. You know that the souls begin with Allah, then in the womb, the earthly life, and then we have the alam of barzakh, the interspace, and then the everlasting life. And of course, the interspace is the human being, where it's considered to be the meeting point of the spiritual and the physical dimension. So now that we've gotten a little bit of the theory in terms of spirituality and a bit of an understanding, I know we've come across this before, so I didn't really want to get too much into it, but you see how this connects in terms of the parts of the self and how this can now show itself in therapy and how we can have that in therapy. So let's get into how behavior change occurs and learning occurs. So through my exploration of the Islamic counseling theories, I found this Islamic philosopher who had already developed an interesting model of change. So Imam Ghazali, he's an Islamic philosopher and theologian and mystic in the year 1058. He proposed the 6 steps towards change. And I believe that this model was developed far beyond its time. As we know also when we look at our hadith and the rights of the Ahlul Bayt, they always had ideas that was way far ahead of their time, that only now that we're seeing the full impact of it, right? So when I took a look at that and examined this change, I could see that the model is in fact timeless. Maybe people didn't really apply it back then, but it can be applied to anyone of any really background and any time, provided this person wants to implement change in their life. So he had a process, 6 steps, and you can compare it to a business partnership, and you can apply that to unwanted behavior. And I find it useful when I apply some of these strategies with my clients, you know, if it's an unwanted behavior or attitude or that is triggering, is causing that distress. So let's take a look at it. So the first step is through musharata. So in Arabic we know musharata comes from the word agreements, shart, stipulation. And so here's to make an agreement or contract with yourself. So in the therapeutic model, when you have a therapist and a client, you're sitting in the session, you say, all right, so I want to change this behavior. You can get the client, like I'd get the client to perhaps write it out themselves. And so they would be accountable to themselves when they go away to work on these changes and come back and see me in a week or 2. So this is something we can all do for ourselves. Any unwanted behavior that you want to change or is causing you distress, you can make an agreement with yourself in terms of how you want to do that. And then the next step is the muraqaba. So this is to guard, and it comes from the word raqab, to guard. So in this step you must, mediate in terms of before you actually take action, right? So this involves reflection, thinking, contemplating, a lot of introspection, and keep watch over yourself, so guard over yourself. So we function as our own observer, right? We're accountable to ourselves here. So the next one is that, the muhasaba, coming from the root word hisab, accountability, right? So here the step involves self-examination and taking into account of your own action, continually checking if you're actually upholding the agreement that you started off with. Then it's the mu'aqaba. So with mu'aqaba, I don't really like that word sometimes because it can be a negative, like it's a form of punishment, right? But really, here, it's about consequences, right? So in terms of mu'aqab, it's about consequences. So if you don't honor your own contract that you put with yourself, you must set some kind of consequence to improve upon yourself. The next one is the mujahada, to strive to make effort, right? So in this step, when we look at the concept of the nafs, it's the lower self that we mentioned earlier and its inclination. So this is the stage of continuous and consistent struggle with whatever it is that we're trying to change, to overcome that lower part of ourself. And so this is the really important part or step where change can occur here. And this is through jihad al-nafs, right? Finally, you have the mu'ataba, to rebuke, or the word repent, atab, right? So in this step, if you have failed to maintain that contract, then you make the effort to turn around, whether it's through regretting or changing or correcting your own ways in terms of recognizing. So this is where it requires a lot of self-reflection and introspection, because you have to be aware and recognize amongst yourself what the error is. And sometimes our ego gets in the way and say, no, I'm fine, or But this is where the change can occur, when you have that openness and awareness, right? So it's your own responsibility and choice to learn from this setback to improve for the next time. So this is what it could look like in terms of the actual model itself. So it can be used as an integral aspect in development of Islamic counseling theories, and this can be applied in therapeutic sessions with clients. And I found that the counselors and the therapists who were taking a look at this, like, yeah, this is something that we've come across in similar Western psychological theories as well. You all with me so far? You guys are going to work on this in terms of maybe some unwanted behavior? So keep that in mind, like what kind of behavior do you want to change? Yes?
Does reward come into play as well, as much as there is punishment?
Reward is, I would say, give yourself a pat on the back. Or the reward in itself is the behavior change, or the whatever it is that you've been working on, right? That's what I would say your ultimate reward is, right? Sometimes it's really hard to start on a task, right? So give yourself sometimes, just a little bit of a similarity. Sometimes really hard to work on getting started for a school assignment. I know this is not the same issue, but procrastination sometimes is something we all struggle with. So how can you work through procrastination? Using this kind of model, we have this strategy in therapy called the 5-minute rule in cognitive behavioral therapy, where you're implementing behavior change. So this is great for students, by the way, the 5-minute rule, or any of us who wants to get started on something we don't feel like doing. 5-minute rule is, the goal is you're going to do this for 5 minutes only. Okay? That's your goal. So set yourself timer, go for it, do it. You're going to do it. 5 minutes. What happens after 5 minutes? The bell rings, okay, you're done. Now what? Ask yourself, reflect here. Can I continue doing this? Do I actually feel it? Chances are, most likely you're going to say yes. Why? Because this was the hardest part to do, getting started. You've done it, the goal in mind was to do it. Look at how the mind over the body gets you to do it. Chances are you're going to continue writing that assignment, whatever task you've started on. You keep going. You notice how we've implemented all of this within the 5-minute rule almost. What's your reward? You're going to finish that assignment, or you're going to do whatever it is that you got to do. You're going to clean out, you're going to do this, that. The reward is actually getting started doing it and completing your task. Now, 5 minutes and you don't feel like doing it. Right? That muraqabah, that awareness and reflection within yourself. I don't feel like doing this. You're not punishing yourself anymore. Why? The goal was to do it for 5 minutes. You actually did it for 5 minutes. You've succeeded. Positive reinforcement is a lot more powerful than negative reinforcement, which is why I use the word loosely, punishment. I'd rather use the word consequences, and this is great in child rearing and parenting, right? Punishment doesn't really work. Consequences works a lot, because then you're more likely to repeat positive behavior and get that positive reinforcement. It's amazing we can train our nafs to do these things as well. We know this during, for example, fasting, right? The training of the nafs. It's all of these concepts pulled together. So let's take a look at goals of treatment. So the goals of treatment from an Islamic perspective present themselves, like we said, from a therapeutic as well as from a spiritual point of view. Therefore, again, emphasizing spirituality in counseling. So, from the therapeutic perspective, okay, the goal doesn't necessarily mean happiness, because people come in and say, and I'm like, what are your goals? What do you want to get out of counseling? I want to be happy. I hear that all the time. I want to be happy. So I change the word happiness and replace it with acceptance, because it has to be the acceptance of our reality and the circumstances around it, and strengthening coping mechanisms to deal with that. We spoke a lot about that at the TMA event yesterday, where it's about not controlling things around you, but acceptance of the reality that we don't have control over circumstances and difficult things, but learning how to cope and manage, right? So this is common in my work with my students, as well as we can apply this to Muslim clients as well. So also moral and ethical issues shouldn't be avoided in therapy. And they should be clarified so that clients can judge for themselves the quality of the behavior and their ideals. So this will result, I believe, in a trustful relationship with the therapist when you have the clarification of the problems to have influence positive outcome. And so again here, the basic understanding for therapists to have Islamic counseling theories, they can help in the therapeutic process. From a spiritual point of view, the goal of therapy is harmony within the self, right? So according to Dr. Salma Yaqub, she's a British Muslim psychotherapist and social activist. Her goal of therapy, again, is to achieve that harmony of the self by optimally balancing the various aspects of the self through awareness of differing influences of social, cultural, family influences, which can lead to that inner peace and without. So she defines that without an actual state of Islam. So she's developed that idea. So where spiritual integration coordinates, again, the whole person, and integration implies the coordination of the entire system around one goal. For us, that's worship towards Allah subhanahu wa ta'ala. So that's that orientation towards an all-inclusive goal. So spiritual values here impart a sense of meaning and direction, again, that concept of spirituality, right? And the spiritual perspective strings the thread of meaning and purpose through the fragmentary and paradoxical elements of life. So the idea here is that only a genuine spiritual orientation can lead that positive effect upon the personality. So a genuine spiritual orientation is lived, not necessarily just used. And it's adopted by inner choice, not outer stimuluses. That's why we call it a way of life. Islam, a way of life. So it's not just the idea of just using it, but actually experiencing and living it. So, and this is an advantage, I believe, for Islamic counseling in terms of getting the client involved in the actual strategies or techniques used with the therapist. Whereas Western is more like, okay, so this is what we're going to do, this is how we're going to do it. This ultimately gives against the client a sense of control and power and responsibility. Therefore, empowerment. And it encourages the person to make the therapy successful for themselves. So this is a definite strength that we could have in our Islamic counseling compared to the Western therapies, because they do more the prescribing type, right? So Muslim psychiatrists and psychotherapists, again, they should have familiarity as well, I believe, with Islamic religion, because sometimes we're Muslim just by name, right? Not necessarily practice. So they can incorporate the Islamic values and ethics and codes of behavior into the psychotherapy. Again, I bring it back to, non-Muslim therapists. They can have the understanding, not necessarily believing it. And so this kind of stuff becomes useful for therapists to use as well, right? But also as us as potential clients to understand, this would be really great to have this incorporated into the therapy as well. So this then leads us to understanding treatment and techniques. So since there is a lot of emphasis, as we know, choice, like we said, in terms of the client choosing what kind of therapy to improve the quality of life, it's inherent that the treatment also are in their hands to apply it. So for example, Muslim therapeutic traditions focus on the spiritual, like we said, the self-development, and this could be through various methodologies, such as we know, reading or listening to the Quran. Now, we've heard this, we know this in our lectures and the Maulanas, and they're always telling us to read the Quran and it has benefits and so forth. We know that, right? And this goes to listening to supplications as well as performing our prayers, right? And so the Quran itself is not just a guide of principles, it also has the healing source when we recite it or listen to it, right? As it reaches the nafs and it opens up the heart to meditate, spiritually uplifting, basically, right? So in times of distress or anger, frustration or depression, the Quran, it can really open up our nafs to that peace, right, that it's searching for. And studies, there have been some studies that actually show its therapeutic value. Now, when I presented this at this conference, I opened up a beautiful recitation of the Quran. I'm not going to do that here for the sake of time. We know the effects of that when we listen to beautiful recitations of classics like Abdul Basit or Minshawi or Tablawi, those reciters. We know what it does when we close our eyes and listen to it. Now, I encourage you, from a therapeutic point of view, because we open up the Quran at our events and all of that. Some people don't respect, listening when somebody recites. Now that you have a better idea of mental health and psychology and what we just described here in terms of applying therapeutic practices, I'd like you to listen to recitations from this perspective that we've been looking at today, from this lens, and see how you feel when you listen to it that way now. So I've included some verses from the Quran. I'm sure you guys already read some of these, where it talks about how the self finds that rest. In terms of supplications and du'as, we know that, similarly, just like the effects of recitation of the Quran when it's listened to, the du'as and supplications also have a similar therapeutic value. So we know that there are supplications within our books that encourage that, and by our prominent imams that talk about how the nafs can reach that state of itmi'nan, And so we see that through Mafatih al-Jinan and the Sahifat Sajjadiyah, where there's so many beautiful recitations that we do after each prayer, days of the week, or also during times of distress and things that are mustahab for us to read. But on a spiritual, psychological point of view, it's incredibly uplifting and powerful what it can do. I remember this presentation, I put a really beautiful dua by Abu Berak Hussain, and you've heard how his voice just lifts you up, and it was quite impactful. I got the audience to close their eyes and do some deep breathing while they were listening to it. Although they didn't understand the words, I had translations. You could see they went into a trance almost when they listened to it, because like we were saying earlier, you don't necessarily have to be Muslim. The nafs, that self, is always drawn and appeal. It has an appeal to that. So it's interesting to see the reaction of people of other faiths interacting with what we know already. This brings us to actual prayers. So we know, again, the effect of salah. We know why we pray. We know, the effects on that. And there have been some research actually done on that in terms of the effects of salah. And I'll get into that a little bit after. But I found it really interesting how, we hear in the adhan. Here I played the adhan, again by Abu Dhar al-Halawaji, and the part in there where it says, come hayya al-falah. What does falah mean? Right? It talks about self-development. It was beautiful in our adhan. It tells us to come to that self-development and purification. It's in there. We have gotten so used to hearing the adhan, we don't actually dissect it and really listen to what it means at that spiritual level. Because we hear it, all right, go do your will, go stand and pray, and we miss out on this part. It's always good to stop sometimes and really reflect upon it this way. So the salah itself, we know that the whole prayer in itself is a solemn and serious affair, in which, as a worshipper, we keep our focus and attention in that meditative, undisturbed state. And again, what happens when we start praying? A lot of us, it's like our thoughts just right away go to, oh, where did I lose my key? Or you guys heard of that silly joke? Like, I can't find my keys. Oh wait, let me go pray, then I'll remember. So bad. But this is what happens sometimes, right? We get so used to doing our obligatory prayers, our mind just wanders. I'm guilty of that too. Constantly trying to focus and do that. So the prayer for us is about that undisturbed meditation on the divine. And for this reason, the prayer is accompanied by recitations of the Holy Quran, speaking of divine mercy, power, and knowledge. And in the Islamic mode of worship, it's calculated to concentrate attention on that one subject, right? The realization of divine presence and the wudu proceeding, and like it's a process, right? To begin the prayer. The reverential attitude in standing and bowing down, then kneeling with the forehead placed on the ground, and the reverent sitting position. All of these, they help the mind to realize the divine presence as a fact, and the worshipper, as it were, finds his heart's joy in doing honor to Allah subhanahu wa ta'ala. Not only with the recitation, but with his whole body, adopting that reverent attitude. It is so beautiful when you think about salah that way, Not just, okay, you heard the adhan, I gotta go do it. Oh, I gotta get my prayer before, it becomes qada, things like that. And so, Research has shown that prayers have shown to have significant positive therapeutic value, especially when it relates to stress. And I find that really fascinating, right? That these traditional techniques are recommended to be performed on a daily basis as a form of meditation to keep our balance in an ever-growing, stressful world of bombardment on our mind, right? To help us increase our spirituality and finding that balance with our physical action. So various articles, research, and explorations of Salah have shown interesting connections and implications to the positive effect of Salah on the physiological, I'm gonna have trouble saying this, the musculoskeletal, did I say it right, doctor? Yeah, and cerebral effects of the brain, and the decrease the psycho and the physiological arousal with relaxation response. So if you look at the different body movements of Salah and posturing, you can see that it's similar to what? To what form of popular therapy for stress reduction and mindfulness? Yoga, exactly, right? Yoga is very meditative, right? And involves concentration and focus. But for us, our salah is through the worship of Allah subhanahu wa ta'ala. Again, that submission of the inner self for the outer Islam. So I find it really fascinating. Like I said, we take salah for granted. But when you look at it from this perspective, the spiritual, the physiological, the research that shows from 1400 years ago, again, I always go back to that. 1400 years ago, our Quran, the Prophet, our Ahl Bayt, they taught us this. But it's only now modern research that proves it in a way. Like for our mind to say, oh, okay, all right, it is like yoga, it is spiritually uplifting, it is meditative. And I personally found it to be very effective in my personal prayers when I try to look at it that way and see it as a therapy, as a form of therapy. And we are blessed with that in the sense that we have that 5 times a day, or 3 times, right? But the 5 prayers a day, we constantly have that spiritual connection and talking to Allah that way, right? So are these the only techniques that we have when it comes to that, I find it sometimes that, as research shows, even as strong as the implications that are in these techniques, there still remains many, as we know, who continue to have emotional disturbances in their lives, even if we apply the traditional therapy, right? So one possibility I found is maybe of why this could be occurring within our communities is that there needs to be a more comprehensive education within our seminars and majalis and lectures to talk about the benefits of these techniques in this way, right? So most Muslims are knowledgeable about these strategies, about how to perform, because we were raised with this stuff as part of our lives, right? But I think there's a lack of understanding the full benefits of this. We don't just teach the child this is how you pray and this, that, although it's hard for a child to understand the full complexities of spirituality and all that, but why is it that there's, art therapy for children at such a young age and things like that in modern Western psychology? Why can't we apply that within our centers and that, bringing that spirituality so young? Not just say, if you don't pray, have you guys heard that meme on social media where it's like, what is it? There's fire, or something like that, and the kids are like, where? In hell, if you don't get up to pray, you're going to hell. It inspires fear. It's funny, yeah, it is funny, but it inspires fear in people to, if you don't pray, you're going to hell. Well, why can't we approach it from this beautiful perspective, the meditative? Why is it that when we're accepting of going to therapy that has mindfulness techniques, we have it in our own salah? If only we could use that lens again with our prayers and our traditional therapies, looking at it from that lens, So I find that there needs to be a little bit more perhaps in our centers, in our conferences, to really incorporate the psychological, the meditative, the spiritual that way, and looking at it in a different way to be able to bring it more, give it more justice, I think, All right, so Islamic guidelines. So as mentioned earlier, we talked about advantages of Islamic counseling in terms of the client's involvement in therapy, right? Choosing a therapy with the therapist. So this ultimately, again, gives the client the responsibility in their hands with the therapist. So when we take a look at Islamic counseling practices, the prescribing versus what Westerners do in terms of Western psychology, the prescribing techniques. So it's important to note, again, like we said, the therapist having familiarity with the religion can contribute effectively. So here we see Dr. Salma Yaqub again, where she talks about using techniques to help with the different tasks, right? So when we take a look at the mind, the task when we look at working with the mind is to challenge maladaptive thoughts, right? What kind of therapies can we use? So we looked at traditional stuff. What can we use here? You can use cognitive techniques. So I presented to you one earlier about the 5-minute rule, right? Working with that kind of thing. There's the body. So maladaptive behaviors, we would use behavioral techniques. And when we want to working on emotions, so the task is to explore feelings and identify and resolve tensions. And so we would use this kind of approach, the centered approach, or the psychodynamic techniques, right? This is more for what therapists would use, but if any of you go to therapy and you see some of this, you're like, okay, I'm not going to be afraid. I kind of heard it in a workshop, these terms before, that it could be frightening or just, again, it's because we're not aware of what they are, right? So, any of you study psychology, by the way? Not a little bit? Okay. So remember when I was telling you to keep in mind some of the strategies, like Islamic practices and theories. So from when we looked at the concept of nafs al-ammara and the lawama, I'll give you the answer throughout the presentation. Western, it's similar. It compares to the id, the ego, and the superego with Freud. There's an R missing there for Freud. So it's comparable to the nafs al-ammara and the lawama. If we take a look at the contract technique that we did with the 6 steps of change, this is similar to the Western psychologist of Robert Ellis, where he talks about making a contract with yourself to work through that. The concepts of free will and choice, Dr. Viktor Frankl and Rollo May, these are famous psychologists. Now, Dr. Viktor Frankl is fascinating. He is a huge influence on the work that I've done. He was a Jewish a concentration Holocaust camp survivor, where he observed those who survived the concentration camps were the ones who had meaning in their lives. So those who suffered found meaning through suffering, had love to live for, but also a belief in God. And so as a psychology student who couldn't really find much on Islam and spirituality, I found his work to be fascinating because it related so much to our beliefs when it came to God and spirituality. So I really encourage you, those who are interested, who want to have a good read on spirituality, and check out his book, God's Man's Search for Meaning. It's a really good book where he developed his special therapy called logotherapy, which is about holistic therapy. And Man's Search for Meaning. Really good stuff there. And finally, integrated psychology and awareness. So this is, again, the Islamic perspective is having a whole integration of everything, not just the physical, like we said, it encompasses the spiritual, everything. The closest form I found was Dr. Gestalt, where he encompasses that. He always talks holistically about everything. He has this really neat technique called the open chair therapy, where he will have a chair in front of the client, and then he will, it's very direct and face-on. Any of you who ever gets to do therapy with me, I'm very much like that, like action-oriented and direct, and okay, let's resolve it. And he does this. It's really neat. Well, he'll have somebody sit across an empty chair. That's why it's called the empty chair method. And he'll get that person to visualize the problem or the person, and we'll get them to work with that person as though they are there. A great way to overcome fear and anxiety and whatnot. But he uses that, he encompasses that. It's an interesting theories there. So to sum up what we looked at today, in this part, so again, the implications that we're taking a look at, for this presentation in terms of justifications for researching this topic and having more awareness of it. Like we said, there was a lack of methodology, a lack of theories from an Islamic perspective for Muslim and non-Muslim therapists to use and apply for clients. So what I looked at was already existing in our faith, but it played around with it to look at it from an Islamic counseling perspective in order to have some kind of theory and proposal out there for practice. So I hope that what I explored here today with all of you is something, you know, to think about further in terms of, you know, if I do want to see a therapist, what is it going to look like, right? And so we took a look again we looked at spirituality, we looked at the definition of Islam in relation to the self, we looked at the 3 types of the self, we looked at free will and choice, we looked at balance and development, fatra, how behavior changes with Ghazali's steps towards change. We looked at various goals of treatment in terms of therapeutic as well as spiritual. We took a look at different techniques, and from that we looked at again the traditional, right, with the Quran, dua, and salah, but then using that with cognitive techniques, behavioral techniques, and the psychodynamic, which is again overall, right? And we took a look at how Islamic principles of counseling are very similar to some Western psychology theories that we already have. Yeah. So I have personally experienced, you know, over the years a lot with Muslim clients where I've treated, you know, whether it's issues of depression, post-traumatic stress. You know, I was fascinated to see how people, you know, they work and develop through their own goals to reach, and it took sometimes it took just a little bit of encouragement, a little bit of prodding for them to kind of redirect their energy and work towards stuff. And so what I found in my own experience was validated through this research, especially just using our own Islamic principles and whatnot. So I hope, inshallah, that, you know, this has been enlightening for you. Maybe not as exciting for you as it is for me or therapists in the field, right? But it's really interesting to see how it all can culminate together, you know? And I hope over the years that we'll have more people getting into the field of psychology and social work, because you see how, you know, I hear a lot of people like, oh, I wish I could apply a little bit more of our faith in my everyday work. Hey, this is the perfect way of doing it, through psychology, right? There's so much rich history out there from our faith and the development of this. I really hope that up-and-coming therapists will really take advantage and do more than the little that I think, you know, I just touched the tip of the iceberg with this stuff. There's so much more like out there in our faith when it comes to the medicine of the imams and all of that, which I've yet to tap into, and I want to learn more about it. And then I encourage a lot of people to do more of that, so we can put it into a formalized, theoretical, but also practical way for new and up-and-coming therapists in our community, inshallah. And I do believe that we can integrate Islamic counseling along with Western psychological concepts that can be beneficial. And as we see the need now with the issues that we're struggling with in our community, whether it's through the topic of homosexuality, Islamophobia, like new things that are coming out in our community now, but have been there all along. And so we need to have some kind of formalized theory to put into practice to reach the ever-growing needs of our communities, inshallah. And this is all about empowering our clients. Any questions? Yes?
Fascinating techniques to describe the traditions that we describe. Can we add ziyarah, I mean, the relation with the others, especially with our imams, our imam of time, and also the other faithful people, as we have been encouraged to make relation with them and be with each other and visit each other.
You totally got it. You totally got everything here in a nutshell with that. We hear that all the time, don't we? That it's so good for you to go. We know the traditions in terms of if you perform, if you go to the ziyarah of Imam Hussain alayhi salam, it's as though you performed a hajj. If you recall the lecture we had last night about the spiritual benefits of Hajj and stuff like that, right? It's all integrated, it's all connected, and there's actually somebody I know is actually now working on a psychological research. She was inspired by the work that I was doing to connect that. She's doing a research on the effects of ziyarah on the psyche and the nafs. And there is huge benefits to that. Who's been on ziyarah before? How have you felt? You tell us. How have you felt when you've gone on that ziyarah? What has it done to you? Relaxation. It's a huge, it's a spiritual journey of some sort for you, where this pilgrimage that you're going on to purify your soul, to leave this world, the physical world behind you, the materialism, right? To focus on that building of that self, the nafs al-mutma'inna, absolutely, right? And also to whom you are going to, what this person represents, what they sacrificed for, right? When you're going, what is it? What does it mean to pay homage to this person? An allegiance. There's so many levels to that. Inshallah, when my friend, when she comes out with this research, it'll be fascinating to see what the results of that would be, right? But exactly, it's all of this, you said it with that one thing, because the ziyarah itself, if you've heard people tell you, if you're not feeling good, or if you're ill or whatnot, go to ziyarah. And there's so much, and if you look at psychological research, the effect of faith and spirituality on healing, there's a huge significant correlation there indeed, and so we can definitely apply that to the ziyarah.
So Quran can be considered as our relationship and talking to God and receiving His answers from Him, and dua is asking just from God, and salah is doing our intention towards God, and ziyarah is something between the creatures, between the humans, the top level humans or the faithful humans, and it is different levels. I think so.
It is different levels. Some is very personal, between you and God, talking to God, right? And then when you go on a ziyarah, yes, it's you and your intention to the imam. For example,
so in the Eid al-Fitr, we have a relation between the Akhwan, yes, and there is a recitation that we say, we get brother, we get brothership, and we withdraw all the rights except ziyarah. This means that ziyarah is something very important among the other rights and the obligations that we have to do to other ikhwan, but this is some exceptional feature that they can.
It would be great to see more research. It would be great to see more research to see the correlation and the effects, because we know that hadith say A, B, C, 1, 2, 3. It's good for you to do this, it's good for you to do that. I'd like to see more research to see the actual effects of that on the mind and the body. That'd be really interesting to see, because we know there are spiritual benefits, but why? And there's so many, if you look nowadays, there's so many, part of the newer generation of the Hussainis, this international Hussaini family that we have. I've seen a lot of people, they go on these journeys and do documentaries, and all of these kind of things. And it's great to hear the stories. And we know since 2002 and 2003, since Saddam fell, the Arba'een has been revived again. I went the year 2000, the first time I went to Iraq, at Arba'een time, nothing. Absolute silence in Karbala. When I went to visit my family who live in Karbala, I'm like, what's going on here? It's absolute silence. There's no ziyarah, nobody's on the street or anything. I never have seen Arba'een after. Inshallah, pray that inshallah soon we all get to go. But what we see now in the millions that people go, like you were saying, the ziyarah is with other people, right? The journey that you go on with other people is incredible and uplifting and cleanses you. And again, what you were going for, the reason that you're going for. And everybody has their own niyyah and intention with that, right? But it's amazing to see the new generation of people, how they document it, how they work with it, how they present it out to people, how they create ishq and that spiritual love. When we see this, and I want to go, I want to experience this, I want to give my homage, I want to send my salam, I want to visit the imam, So it's amazing to see that now, and I get so excited and and so proud of the young people who are creating this Hussaini energy out there for people to go and do that. So we're not just looking at it anymore of what we hear the sheikhs on the mumbar that say, it's good for you to go do ziyarah. And we're going deeper as to why and from a psychological perspective. Okay, one last question. I'm going to take a break because...
I'll ask a short question.
Sure.
I'm actually understanding the special case of the Muslims who live in the West. I understand how, we live in the Western world, and so there has to be a kind of marriage between our worldview and how, Western approaches can be beneficial to us in terms of healing. What's the approach in the East or in our countries of origin where they've been using psychotherapy or counseling? What's their kind of theories, or what's the model that they use? Is there such a thing? Is there any formalized approach?
At the time when I was doing this research, I couldn't find anything. And over the years, I just applied what I learned by combining, Western and just my own thing. I know now that there are journals, like I said, and books and different models where it's become more sophisticated over the years, I haven't seen any specific ones as of yet because I'm still learning what there is out there. There's this book actually called Counseling Muslims, and it came out a few years ago from, I forget the name of the author, Dr. Ahmed, I forget, but she's from the States, and so she developed this great publication where she talks a lot about some of the stuff that we talked about today.
But also from the West.
From a Western point of view of counseling Muslims in the West. And so it's again similar with spirituality, but I haven't, like I said, I haven't delved into it fully yet, which is why I encourage more people to get into it. I am so busy with therapy that it's so hard sometimes to find the time to explore more what is out there. It's a full-time job to do the research and whatnot, right? Which is why as a student I had the ability to do it, but then I put it into practice and developed my own thing as I went along with others. But I would imagine that there are more people out there developing and doing more research and presenting it, like the Muslim Mental Health Conference down in the States. They're in their 9th or 10th year now in Dearborn. And they work with the medical department in Michigan State University, I believe. The Serenity Islamic Mental Health Awareness Group, which is a group that I worked with in Ottawa, we developed. We had our Canada's first Muslim mental health conference in May 2016. We have information here about that if you guys want to. And so last year, the Medical Muslim Association of Canada had their first mental health conference in Toronto, and it's again this year, I believe in October 22nd. So it's getting there, it's developing, and then you'll have more people who have the full-time ability to do more research to present what they have out there in terms of theories. This is just one of many, but we need more within our own communities as well. All right, so let's take a quick break, and we're going to end off, inshallah, with how to put all this into practice for having a healthy overall lifestyle and balance. So guys, stretch, go get a break, get some chai, get some caffeine in you. I know this was a bit draining on all of us, which is why I was sitting down. Sallallahu ala Muhammad wa ali Muhammad.